So thank you folks for coming this afternoon. So I'm going to call the meeting to order for the Winnebago County Community Mental Health Board meeting for the month of March. And first thing is we're going to call to order and get our roll call. So Marianne Abadi, Dr. Edward Copeland, Dr. Terry Giardini.
Got it right this time.
I know. Dr. Gorski. Okay. Wendy Larson Bennett.
Present.
Tim Neighbors.
Here.
Okay. Mohammed Yunus. Okay. And Richard Kunnert. And then Jason Holcomb. And we have our staff, Chelsea Glantz, Nicole Bennett, and Mark Hook are here this afternoon. So, okay. Anyone for public comment this afternoon? Okay. I'm not having anyone calling the comment. Then we're going to have a presentation to the board from Live for All. And my board members, please, this is not, this is just simply their presentation for under the accelerator program. So if you all would like to come forward, make your presentation, we'd love to have you.
Just give me a moment. Zoom is giving me an issue, and we'll make sure we are still live streamed. The Zoom just ended.
Yeah, let's just read it. Wait, oh, no, I think it's good.
I'm just going to do a slideshow presentation.
Got it. Very good. Thank you, Jason. My name is Laura Fry. I am the grateful Executive Director of Live for Lolly. My appreciation to the Mental Health Board for this opportunity to present. I know that you've done your homework, so I will keep my general introduction short so that we can save time for questions. We have provided each of you with a copy of our impact report for 2023. This was just completed on Friday, so we haven't gotten the official ones back from the printer, so pardon us for the photocopies, but that's what we have. Live for Lolly was founded in 2009 after the overdose death of 20-year-old Alex Lilliverte. Much has changed in 15 years, unfortunately, not the rates of overdose death, which continue to grow exponentially. We currently serve 8 counties, providing naloxone education and distribution, recovery coaching, case management, treatment navigation, family coaching, peer support meetings, and harm reduction. When the opportunity presented itself for expansion, we looked at a few factors. What nearby communities did not have a recovery community organization, which is a designation by Faces and Voices of Recovery, which Live for Lolly has had for over 2 years. We also look at data, overdose rates, rates of addiction, underserved communities, areas without a harm reduction program. These are some of the demographics that we look into. We know that Rockford has the highest overdose rate per capita in the state. So we decided on expanding the Winnebago, Boone, and Kane counties for all the reasons mentioned. After a 2-year study of our services from 2017 through 2019, we found that approximately 30 people walked into our office to receive treatment navigation or harm reduction services. We then decided that we needed to bring services to the people, and our mobile outreach project was born in March of 2020. Originally funded by 2 family foundations, we have looked to other funding opportunities to expand this model. Before launching a new mobile outreach location, we like to start with a needs assessment, engaging not only pertinent stakeholders, but also the participants we serve, which means actually walking the streets and talking to impacted people about their needs around substance use. Typically, this process takes between 1 and 2 years. Depending on feedback from the community stakeholders, we generally start with 1 or 2 mobile outreach locations. We currently provide mobile services to 10 locations, 5 days a week. Last year, we served 6,671 participants through mobile outreach. In the 4 years since we launched, we have served over 20,000 community members in Lake, Henry, Cook, and DuPage counties. We have had to be flexible as some original sites did not reach as many people as we had hoped. So reassessing and moving to new locations has to be considered. No 2 rollouts have ever looked the same. For example, one of our Lake County sites is in a food desert. Our participants tell us that we are the only source of fresh fruit for the week. So we continue to hand out 50 pounds of fresh fruit every Thursday. In Winnebago County, we opened an office in Rockford on State Street in November. We have consistently gotten 2 to 3 people Monday through Friday walk in for peer support. Just this past Monday, one such person walked in and wanted help, was tired of the rat race and wanted out. They secured a bed at Gateway Lake Villa, and yours truly drove them from Rockford to Gateway, where they are now finding freedom. We know from our own data over the last 4 years, we will be able to provide this service to many more people with mobile outreach. We know the county is much larger than just Rockford. To establish a broader footprint in the county, we felt an advisory council made up of residents, business owners, officials, faith communities, and our participants was necessary. We currently have a medical provider, faith leader, and community member in recovery that have answered that call. We will be adding between 3 to 7 additional members to the advisory council. This group of dedicated volunteers will guide us on programming, give us fiscal oversight, and help drive the future growth in Winnebago County. We never start or expand a program without a sustainability plan. The last thing we want is for participants to become accustomed to receiving services, then losing them because of funding. We believe there is fertile ground and a definite need for expansion in Winnebago County and plan to engage in all of these opportunities, especially collaborating and partnering with other agencies to provide the best wraparound services we collectively can for each individual we serve. We know there are many gaps in services, not just here in Winnebago County, but within the entire state. We can bridge some of those gaps with cooperation and collaboration. So why did I come up here with a black balloon today? You might be wondering. Today is National Black Balloon Day. This is a day set aside to acknowledge and talk about those lost to overdose. A day where we ask people to put black balloons outside their homes and businesses to encourage talking about overdose and removing the stigma of doing so. Every single overdose death is preventable, regardless of the outcome with the Winnebago Mental Health Board. Live for Lally is here to help reduce overdose deaths, reduce communicable diseases among substance users, increase peer support, and help educate the community on substance use. We look forward to supporting and partnering with you.
Thank you.
Yeah.
You may.
All right, Laura, thank you for your presentation, obviously very good, but my question is this, are there other organizations that you may be overlapping with in this community? Because there seems to be a lot of focus on this, and I'm just wondering if, when you're coming to the party right now, are you coming in with others at the same time?
Not that my research has shown.
Okay.
I don't know of any other mobile harm reduction programs.
Okay.
We do know that there is other, like we met with, the police and the mobile crisis unit. Those are people we want to collaborate with.
Okay.
Because we can offer the overdose piece, the specific peer support piece. We are all impacted people. Everybody on our staff is either lived or living experience with substance use, so it's kind of unique. I see us as being able to complement what's happening, and you know, to be honest, can we really have too many people distributing naloxone? Yes, sir.
It's a question for Jason.
Oh, sorry.
So is this the same program or a different program that presented to us last?
So this is, well, there was public comment last month. And
Okay.
for a representative from Live for Lally did make a public comment.
Okay,
So that wasn't a presentation. They did do an abstract that was not accepted, and they also have an accelerator award. So part of the reasoning for having them come in today was to better understand, I think among other things, if they could still even do the accelerator part without the abstract funding, since that has been done. And could you maybe comment on that? Because I think that was one of the questions the board has. You had two proposals, one for new programming under core programs and one for accelerator. I think there was a question about, you know, if the funding wasn't given for core programming, you know, were these dependent on one another, or is this something, you know, the accelerator vision, is that something that can be done without the core program?
Absolutely. What we are proposing is bringing mobile outreach to Winnebago County, so that can stand alone without the other program.
So, Terry,
Go ahead.
go ahead. Oh, I just see you're co-located with TASC.
We're in the same building, yeah.
Have you reached out to TASC?
Oh, we've worked with TASC since our inception.
Okay. I mean, is there a partnership where,
Absolutely.
like something formalized?
We do have a signed MOU, yes.
Okay, so that would be useful for, I think, us to see what the partnership is. I also see that Violet Joniker is a proposed board member. She's not at Brook Road anymore, is my understanding. She's running Rockford Urban Ministries. No, is she still at Brook?
Yeah.
Okay, all right. But you're aware that there was a mobile harm reduction program a number of years ago, run through Rockford Urban Ministries. Have you talked to them at all? I guess my main concern is your unfamiliarity with the community. You know, it's great to say we're gonna go out and do these things, but I'd like to see more firmly embedded with the community or with people who are familiar with where and what the issues are here.
Exactly why we are putting together an advisory council. Everybody on the Rockford staff is from here. All people in recovery, so they handle from a residency point of view. We've been working with Violet closely. She's a personal advisor in addition to being on the advisory council. I don't think they're doing any harm reduction or one-on-one peer support.
Not at the moment. I think there are other organizations that perhaps are, I guess. And my other question is, what is your anticipated time of operation for the mobile
Well, we would do a needs assessment, and depending on that, I see us being able to, we have to buy the truck, we have to do the construction. I see us being able to be up and running within a year.
Thank you.
Yeah, my question is, do you get any kind of support or funding from Illinois Department of Mental Health?
From, I'm sorry, I'm hearing.
Illinois Department of Mental
Mental
Health.
Health.
We get, our current grant for working here in Winnebago is from Super, which is a part of DHS. We also get funding from IDPH, Illinois Department of Public Health. In Cook County Department of Public Health. We are in our 7th year of a grant through the McHenry County Mental Health Board to provide these services to McHenry County. We are about 65% grant funded.
Okay. You got a very good program, no doubt about that. And your pillars of focus is a very good idea. I mean, but one focus is missing, empathy. Empathy is very important when we talk about substance abuse. And that part is missing from it. It's like I see.
And what's missing? I'm sorry.
Empathy.
Empathy.
Yeah. It's not missing.
In terms of focus, I don't see any focus. That I'm not saying that the focus should be empathy.
Okay, I hear you. And maybe we should reword one of our values.
Maybe better wording.
I mean, gosh, if we didn't have empathy, I don't think.
When you talk about pillars, it should be one of the pillars.
Thank you for that. I will, look into rewording.
Okay, thanks.
Any other questions?
Thank you
Thank
so
you.
much. Those
Thank
were
you.
Great questions.
Thank you. Thank you very much. Okay. So then, monthly activity report.
Thank you. Yes, there is a lot going on. One thing is that we have finished the print on the annual report, so you should have copies of those you can review. I know we did a brief presentation on that at our last meeting. Also, this is kind of a what's happening and a looking ahead, certainly topical for the members of the public that we have here today. Some of whom sit on the CESA Region 1 Advisory Committee with me representing the Mental Health Board. And they have been looking into the Region 1 CESA Committee into hosting a summit that could start to show best practices, share best practices regionally, and maybe even open that up to other regions within the state. So I'll just keep you posted on that. It's kind of being spearheaded by the DeKalb County Mental Health Board, and they've asked us to maybe lock arms with them on that. So we'll keep you posted on that if that moves forward as it's been discussed. And certainly would love to have our local other members join us in that and be part of sharing the best practices that have been developed here in Winnebago County as it relates to crisis response. And you know, there's a lot going on, but that's the big update I want to share with you, and everything else is kind of summarized there for you in our activities report.
One of the things that I'd like to comment on is the evidence-based. Evidence-based, you know, that's what it's in our application, that we want to see evidence-based programs. And people mention that in their applications, but what they don't mention is what is the study that they're choosing to replicate. Because evidence-based is basically saying that you're replicating the work of another organization or study that was done where there is evidence that it was useful. And so some of the applications sort of like want us to take for granted that they mention that it's evidence-based, but they don't give us what it's evidence of what.
They don't give us a program on it.
Yeah, exactly. So that they're replicating and which leads to another thing, and that's training within the organization, because it's kind of like saying, if you're replicating somebody else's study, then could you show me the training that one or more of the people in your organization have received, since they're supposed to be the ones who are in effect, performing the service. So anyway, that's my bias.
Even better if you can share a systematic review of multiple journal articles.
Okay.
Right.
But can I also ask, as part of that, and I guess this is more of a philosophical question, do we as an organization have room for an organization that wants to try something new? This hasn't been done before, and here's the motivation, here's the unanswered question, I guess it needs to be sort of a research kind of,
That's the best practice part.
okay, all
Okay.
right, so,
Yeah,
So-
and we do.
so the answer is yes,
Yes.
in the proper form,
And we have agencies doing that.
right?
Yeah, okay. Oh, Tim,
So that was one of my, well, not that particular issue, but to tag along with that particular issue of providing evidence-based plan, I was looking at the applications that I had gone through. And I would like to see organizations tighten up on their budget. And, we're giving away money and they're not using all the money, blocking it from other organizations to get the money.
Right.
So along with the evidence-based practices, I would like to see them tighten their budget up and be more detailed in their budget, because a lot of times it irritated me to see that they had budgeted for a new computer and new printer every single year for different staff. I was like, you're not gonna need that every year. It's just, we need to see tighter budgets when they apply for that. So that way we could, give out more money to other organizations instead of just hogging it and not using it.
And Tim, in that vein, when on day one, your budget is allowing for the hiring of 10 new staff, do you have the 10 staff waiting to jump on payroll day one? Or how long is it gonna take you to hire the 10
Right.
staff? And let's take that into account with the money that is being asked for.
Right.
In other words, you want us to read more. You want us to read more.
No,
I want them
No, it's not necessarily reading more. It's just like when we look at the summary report and they say, well, they've only used, when we go through year one, they only use 40% of the budget. Year two, they only use 44% of the budget. The other 60% could have went to another program instead of been locked up with that other
I
organization.
agree.
But should they, I mean, if they're lapsing the money, if they were granted about $1 million, they will use only 20%. What happened to the 80%?
It's in our.
And we still have it.
Yeah, it's in our
We still
reserve.
have it, but it's locked up because we promised it to them.
But the agency didn't use it.
Right.
Is the money coming back to us?
No, they don't get it.
They don't get it.
They don't get it. They get
They lapse it, I mean.
receipts. They gotta
They have to turn in receipts.
they gotta turn in an invoice in order to get paid.
yeah. Yeah,
It's not very clear.
it's not, it isn't like we used to see with the Department of Mental Health. Okay, all right.
Yeah, you know, back in the day,
I was
you
gonna
would
say,
get $1 million grant, and on the last 2 days of the grant, you'd get a call saying, you've got $1 million to spend in 48 hours, go for it. That's not what's happening.
No, no. Okay. Any other comments? All right. So the next piece of business is, for us to approve last month's meeting minutes. So can I have a motion for acceptance of those minutes?
so moved.
Okay, second, okay, all right, all right. So Dr. Copeland passed and Mohammed Yunus seconded. Get a voice vote, all in favor?
Aye.
Anyone opposed? Okay, thank you. All right. Then we move to our actions for this month. And in the first one, we have the resolution authorizing budget updates for the program year for two agencies, Circle of Change and for the City of Rockford Human Services. So do we need any comments?
I could just give you a brief summary, and if you have questions, we do have representatives from each organization.
Okay,
Circle of Change had originally intended to contract out some of their administrative support, and that's now being done in-house with their existing staff, so that's a switch from same amount of money that was in contractual for that being switched to personnel. And on the City of Rockford Health and Human Services, really at the instigation and requirement of the Mental Health Board, the Mental Health Board had made a special condition for them that they figure out some model of clinical supervision because all of the staff that they'd be hiring would need clinical supervisory
Correct.
support.
all right,
They have reached an arrangement with Rosecrans to do that contractually through Rosecrans to have access to a licensed clinician who can provide clinical supervisory needs to the direct outreach staff. And so to their credit, they have made that arrangement, but in doing so had to find other areas of their budget to reduce to pay for that service. And so you're seeing where they found that they could shave a little in their other line items to make space for that.
okay. Okay, any questions about that? Okay, hearing none. Since there's money involved, those in favor of the resolution?
We have to have a motion
Yeah.
We
to,
need, I'm sorry. Yeah,
Also move.
okay,
I'll second.
all right. Moved and seconded that the resolution 2024 X be approved. So then let me go down to my Mariana Botten, Dr. Copeland,
Aye.
Dr. Giardini,
Aye.
Wendy Larson Bennett,
Aye.
Tim Neighbors,
Yes.
Mohammed Yunus,
Aye.
Richard Clinton, yes. Okay, all right, then we move to our second resolution, which is regarding the budget. So this is to amend our Winnebago County Mental Health Board fiscal year budget as a result of the new legislation that we had. So Jason, you want to comment on this one?
Yeah, I would like to comment, and I'll just share a brief presentation of a couple of slides so we can recall where we are on this issue. So number one, if I could just say that we are through January, that put us 33% of the way through the fiscal year. And on the reduced administrative budget, we're at 31% expenditure. So I've made sure that we've stayed true to what our modified budget was, but that has limited me from scaling up to do all of the things that the board has asked us to do in the new 3-year strategic plan, which includes those systems coordination components, addressing some of the issues around transportation, language services, getting our accelerator program up and running, which when we have these awards, getting the contracts ready. So I have stayed on budget, but it has not been, it's required us to really prioritize the core things. And so for us to scale up and do the things that was approved in that 3-year strategic plan, we will need to put the budget back to what was originally approved by the board back in June or July. If I could just go to presentation mode here, I want to just, I guess, for full transparency, kind of recall that the things that Region 1 planning does on our administrative support side is the strategic planning, managing the grant programs, doing the program evaluation and data collection, and summarizing all of that data back for the board and the public, trying to address the systems coordination issues that are structural to make sure the programs are functioning and working together, that there's a coordinated system of care, and then engaging the public both in giving us the input and feedback we need, and then promoting and that what we're doing back to the public. So nothing has changed in terms of the service offering. It's just about scaling up to meet the increasing programmatic needs. And then if we just look again at what that looks like in terms of a percentage of our administrative cost versus whether you're looking at it as a percentage of total revenue that's coming in or a percentage of total expenditures for the full budget, we remain less than 5% every single year that we operate on administrative expenses. And when we benchmark that against other mental health boards, we see that the average is around 10%. So we're operating still as the leanest mental health board, and this budget change does not shift that at all. It's just about meeting the basic demands to keep a growing program going. So I just wanted to put that out there as kind of a reminder of why we're doing this and why that original budget was set to this amount. And with that, happy to answer questions if there are any, but it is going back to the original budget set by the mental health board.
I guess I just asked Tim, are there going to be waves as a result of this, or is this what was expected? You know,
This was suspected, ways don't matter anymore. January 1st.
okay, all right. Okay, that's what I wanted to hear.
Peace be still.
Well, they can find another way, but you know, it's
It's a quick question, just for my general knowledge, out of the things that the sort of tasks that R1 does, it seems to me that you are also participating in like state and national things. Where does that fit in with?
Systems coordination, on the systems coordination part of the strategic plan, even we have that in there in terms of liaisoning to state committees and things that we know will have a direct impact on the mental health services for Winnebago County that we want to have a voice in. So we liaison in those roles as well, and also on local committees that are going to have a direct impact on service coordination.
Do I speak for you in terms of saying how happy we are with the relationship that we've had with Region 1 and what we have arranged for in terms of our administrative staff and support staff? I mean, I think this has been terrific. I agree in terms of like what they have done and how they do it, which, I mean, again, just today again is another example of very professional kinds of support, okay? So, yeah,
And incredible efficiency.
yeah,
I think we're getting
we're
a
happy,
bargain
we're happy campers.
and huge level of
Yeah.
professionalism.
Yeah.
Well, in today's environment where everybody talks about transparency but hides behind it, I would say, Jason, that's, you know, you keep it 5% or less, that's really phenomenal. That's great. That's great. Thank you.
You too.
And Chelsea.
And Chelsea.
Yeah.
Whoever that
He's the new guy. This is Mark.
Thank you.
This is Mark.
Appreciate that. Go get up.
Mark the hook.
That's right.
Appreciating all the nice comments. This is not just about administrative increases. This also adds in the money that is currently not in our budget to do the accelerator awards and the core program grants, which as it stands are not in our budget, so we cannot award grants until this budget change happens.
Right, okay. So with that, we need a motion to accept this resolution, 2024 XX20, the resolution to amend the mental health board fiscal year budget.
So
Tim, okay, Terry, okay, all right. Since there's some money involved, Dr. Copeland.
Aye.
Dr. Giardini,
Aye.
Wendy Bennett,
Yes.
Tim Neighbors,
yes,
Mohammed Yunus.
Yeah.
Richard Clinton, yes. Okay, thank you. All right, so, then our final resolution for today is, mental health board's accelerator award preliminary review determinations for the applications that we've received. And so in this section, I mean, I think, we'll just call it out, right?
Sure. Oh, yeah.
Okay, all right, so we have proposals from the Boys and Girls Club of Rockford, which has been accepted. City of Rockford Family Peace Center,
Meaning ready for review.
right, ready for review. We have found that the Berkeley Museum of Natural History's application is not fitting with our mission. And so that we are turning down. Yeah, we have several other programs that we want to get more information dealing with their application, and that is Alignment Rockford, NAMI, Northern Illinois, Stepping Stones of Rockford, University of Illinois College of Medicine, and the YMCA. They will be receiving information about exactly what kinds of information we would like to see so that we can continue to give consideration to their applications. So with that, if you don't mind, I would like one more motion for the resolution. Okay, okay, we'll go to you in a second. All right, so the resolution authorizing the county mental health board to review determinations of applications received. Let's see, we have money involved, so I would like to go through. Dr. Copeland,
Aye.
Dr. Giardini,
Aye.
Ms. Bennett,
Yes.
Tim Neighbors,
yes.
Mohammed Yunus, and Richard Clinton, yes. Okay, all right.
Take, if you don't mind, I just, as we're talking about accelerator awards, we kind of passed out a process chart for you because I wanted you to understand. I know it's a new program for us, so it feels abstract and like there's a lot of different pathways to get to the kind of finish line on a proposal. And so I wanted you to see what that looks like visually. And so when it goes to the next step or it needs more information, where that puts something in the process. So hopefully that can be helpful to you at this moment in time. Nothing has been put up for a vote on making an award. We're just still in that review on things and gathering more information and scheduling presentations. One piece of place that I
Would you want to put that up?
Sure, I can put that up for everyone. And one place I think that it would be helpful to get some board member feedback is I think as we see what your reviews look like on these, we are noticing that A lot of board members are wanting more information even after they do the full review on some of these. Because of the amount of money that's being requested versus the amount of detail in the application. Of course, we made it that way intentionally, so it wasn't terribly difficult for people to access, knowing we could have them come to a presentation. So with that, if we schedule presentations only at these scheduled board meetings, at some point, we're gonna have 2, 3, or 4 of these. We can do that, or we could consider scheduling some special board meetings just for presentations. And I wanted to get some feedback from board members, what your preferences might be around that, and then we can do the scheduling as we need. Tim?
Or the other thing we can do is have them do a video presentation. That way it can be emailed to us and sent to us at our own time.
I was thinking the same thing. If we can be specific enough in our questions to give them an idea of what we're looking for or what we need clarity for, I think that will save everybody some time, them and us.
Okay.
They could do a little video.
You won't have the opportunity for live questioning in that
That's
format,
the drawback.
But
we can still do that.
if they do that, then they sign up for a presentation. That way we could just ask questions instead of going through the whole presentation.
Okay, so some pre-work for the
Okay.
presentation to shorten the amount of time.
Yeah.
The other thing, the areas that I am sort of in my own head unclear about is, so someone's asking for $1 million to build a building. I want more information. Who have they talked to about building a building? What's the size and shape of the building? How do they know that $1 million is an adequate amount to do what their aim is, There was one where I thought, I know building costs are like for residential are a couple $100 a square foot. They're not gonna get much of a building for the amount of money they're asking for. I'm thinking they haven't really thought through. It's more like a dream. We'd like a new location, but they haven't really thought through the nitty-gritty of even just sitting down with an architect and saying, how do we do this?
I agree with you. I saw several applications. I'm wondering, why not rent?
That hadn't even occurred to me until I heard someone ask that
There's a
question.
lot of different spaces around this community, so like, I find it, I'm not willing to kind of try to build a new thing. That, and look at how many corporations don't own their own buildings.
Right, that's true.
And they essentially rent.
And one of my concerns also was location. Where are you talking about putting this building? My personal thought is, I have a concern that there's too much stuff on the east side of the river. And there are deserts on the west side of the river. And where people, there's no bus service, there's no access. We need resources spread through the county. How are we gonna address that, mobile services are one aspect of that, but anyway, so those, and also thinking about where the wish is for, personnel or like, an educational program. I want more details of how much the cost is, per pupil, per client. How are we gonna, let's now start going from dreaming it to actually breaking down the budget in a realistic way so that we're not ending up with only using 44% of the allocated money, but we're also creating a sustainable program.
So I have a question about, just as you think about where we are now and where we're gonna be in the next few years in terms of volume of applications and how we're currently assessing them, not just this, which is extremely helpful, but our normal founded thing. I know that you all are always thinking of ways to streamline and sort of make things better, but in light of what we're talking about, and I know that we, once grants are given, their site visits and all that kind of stuff to check things out. But I'm wondering if, as we look down the road, if there's a way, even within the I forgot what you call it, but the learning,
Yeah,
Sessions.
collaborative.
the collaborative thing, that people are invited to and all that kind of thing, if we can impress upon people more of the things we're saying like right now, so that they'll know what kind of help to ask for, hey, we're this many years into the process, what we noticed is this. So not like frequently asked questions, but frequently asked deficits that, hey, as you're coming to get information about how to apply, we want to, as board members, let you know that, hey, you think about a building, these are the types of things that we are thinking about. If you're thinking about this, we're thinking about that, so that we can help them on the front end, sort of either be realistic about what they're thinking about or get help to sort of give us the best product, so that on the back end, we're not having to ask as many questions.
Yeah. Well, thank you for the feedback. I think that does give us what we need, so I think we can offer some opportunities to do some pre-work from the agencies that then maybe we can stack more into a shorter period of time when they actually come to the board during our regularly scheduled meetings.
And I don't think our aim is too daunting, but if you're asking for, 6 or 7 figures, I would hope that there would be enough clarity in the ask, that we understand this much for personnel, this much for building, this much for HVAC, this much, whatever it is, that they have thought about it and done some real planning.
All right. Does this represent our discussion items?
Yes, it does.
Okay, all right, okay. Do we have any other matters that need to be brought before the board?
I just wanted to have one thing on your radar. I'm gonna be sending you all an email to sign up for site visits, since Dr. Copeland brought up the site visits. We created a survey to try to make it easier for you to schedule site visits, so look for my email, so which ones you're interested in attending if you can, what your availability is for attending, and if you have any questions, you can just email.
Nicole, one other thing, these site visits are excellent, but I wanna go more than one time. I wanna see how they're progressing. It's one thing to get a dog and pony show, I wanna see how they're progressing,
Okay,
okay? I
so,
mean, I wanna go back.
okay, I can also send you a list of the ones you went to last time, so then you can maybe visit
I
them
might
again.
go back,
Okay.
yes, absolutely.
That's a good idea.
I think it would be good for us, surprise.
Exactly.
Oh, that's good. Can I tell you, I went to Jubilee Center, for my site visit, and I've been dropping in, I've been bringing stuff,
Their new friend.
I don't know if they know who the heck I am, I don't think I care, but I see what is happening there, and,
Yeah, I think that whole secret client thing would be, not client, but participant, or at least observer, I think that'd be useful. I was thinking the same thing.
Well, we are always looking at ways to monitor compliance, and certainly we can look for some additional measures if you find that would be helpful. We communicate with our, other mental health boards regularly about what they're doing on compliance monitoring, and some of them do file audits, so we can certainly continue to bring those ideas to the board, and when we decide how you would like us to monitor those programs.
Okay. All right, I would entertain a motion for adjournment.
So move.
second.
Mr. Yunus, you want to second that? Okay, all in favor? Okay, do I hear any opposition? None. Okay, good. Thank you. Thank you, everyone.